When people do Kegels, does it really actually work? Is it the same as other exercises for pelvic floor? What is the best way to do Kegel exercises? That's the subject of this video. Hi, I'm Dr. Shakib from Core Pelvic Floor Therapy in Irvine, California. Stay tuned. All right, so we're always, if you have pelvic floor dysfunction, if you have incontinence or not, it doesn't matter. Incontinence is a variation of pelvic floor dysfunction. You hear about Kegel, you see and you hear about pelvic floor exercises, but one thing that I want to make sure is clear is when you're doing Kegel exercises, you can only engage so much of the pelvic floor muscles, the floor of your pelvis. You have to understand, floor of the pelvis is not free floating. So there are attachments, therefore the health of those attachments heavily influence the integrity of the pelvic floor muscles. So when you're doing Kegel on your own, you only really engage a specific portions of the pelvic floor muscles, nothing on the inside necessarily, the inside lining of the pelvic inlet. Then there are other exercises you could be doing, but the really key ingredient to proper exercising your pelvic floor is to really be able to engage your pelvic diaphragm. I've done a video on the difference between pelvic floor and pelvic diaphragm. We're going to make sure we put it at the end of this video. So you got to be understanding the pressure and the integrity of the structures above, the integrity of the attachments that the pelvic would influence the pelvic floor. All of those are very important. So don't think doing Kegel is enough. Don't think doing those other exercises mechanically is going to do the magic. In our office, we're heavily into educating our patients about the whole pelvic floor area and everything that impacts it. We have a machine that does 400 Kegels a minute, and that's not just on the superficial layer, which is what we're used to when we do Kegel ourselves. So it actually, patients describe it as the whole inside of them. They feel that it contracts and lifts. So you gotta do too many things out there, all with best intentions, but you can't just pinpoint one and say that's the best. It's a collection of things, and at the end of the day, you gotta understand that you, as the owner of this pelvic floor, need to really be very familiar with what it is that you're doing that may adversely impact the health of your pelvic floor. If you have any questions, comments, or suggestions, please contact me using one of the methods of contact in the description box. You can follow us on Instagram and Facebook, and if you need to make an appointment, just give us a call. Thanks for watching.